This video is an introduction to osteology, which is the study of bones. This is the first subdiscipline of human anatomy that we will study. Human bones are part of the musculoskeletal system, which allows us to move our body and change the position of its particular parts. This is one of the most essential functions. The musculoskeletal system consists of two parts. The passive part, consisting of bones that are connected to each other in various ways, and the active part, consisting of muscles that provide motion to the bones. The skeleton of an adult is made up of 206 to 208 bones. This amount depends on the individual anatomical features. The human skeleton can be divided into two parts, the axial and appendicular. The axial skeleton includes bones of the skull, the vertebral column, and the thoracic cage, also known as the rib cage, which consists of ribs and the sternum. The appendicular skeleton includes bones of the upper limbs and lower limbs. At a microscopic level, bones consist of bone tissue and cartilage tissue. At the stage of embryonic development, our skeleton consists almost entirely of cartilage tissue, which is replaced by bone tissue during later life. However, in some cartilages, such as auricular cartilages, this change does not occur, and they remain cartilages. This special physicochemical balance of organic and inorganic substances provides high mechanical strength, density, and flexibility of bone tissue. In the elderly, this balance shifts towards inorganic substances, making bones brittle and fragile. Microscopically, two types of bone are distinguished: compact and spongy. The so-called central or haversian canals are packed tightly along the bone. Inside the medullary cavity and in the cells of the spongy bone, the bone marrow lies, which performs hematopoietic and protective functions. The bone is covered with the periosteum, a strong connective tissue plate rich in blood vessels and nerves. On the surfaces of each bone, there are various prominences, sulci, grooves, eminences, etc. Muscles and their tendons, as well as ligaments and fasciae, arise at these spots. These are also where vessels and nerves pass. Bones differ from each other in shape. There are the following types of bones: long bones, for instance the humerus; short bones, for instance carpal bones; flat bones, bones of the skull; and irregular bones, for instance facial bones. The so-called sesamoid bones are distinguished separately. They do not attach directly to other bones, but are located deep into the ligaments and tendons. Macroscopically, the following parts are distinguished in a typical long bone: the middle part, which is called diaphysis; the proximal end, which is called the proximal epiphysis; and the distal end, which is called the distal epiphysis. The metaphysis is the region where the epiphysis joins the diaphysis. In children and adolescents, this part consists of metaphyseal growth cartilage, which provides bone growth. As an individual becomes older, the region of the metaphysis mineralizes and the growth plates fuse.